Assalamu alaikum. I am Dr. Asma Hosna, Associate Professor, Department of Pathology, Bashundhara Ad-din Medical College. My dear student, welcome to you all today's Pathology online session. In our previous class, I have already discussed about anemia and the classification of anemia and also about the common clinical features of anemia. So, now you know that the anemia can morphologically classified into three categories on the basis of MCV, MCH and MCHC concentration. And morphologically it is classified into microcytic hyperchromic anemia, normocytic normochromic anemia and macrocytic anemia. Today I am going to discuss about our first topics, that is microcytic hyperchromic anemia. In microcytic hyperchromic anemia, at first you have to know the common causes of microcytic hyperchromic anemia, and the common causes are iron deficiency anemia, thalassemia, sideroblastic anemia and anemia of chronic disorder. So, at first we know about the iron deficiency anemia. What are the causes of hyperchromic and microcytic anemia? And that include lack of iron deficiency, lack of iron release from the macrophage to serum, and which common in chronic disorder or in malignancy. It also causes sideroblastic anemia, which occur due to failure of protoporphyrin synthesis, thalassemia, which occur due to the failure of globin synthesis, and also inhibit hemoglobin synthesis. Now, at first the iron metabolism. In iron metabolism, we have to know about the amount of iron in the food, the size of iron store and the rate of erythropoiesis. And the excretion of the iron in our body is 0.5 to 1 milligram per day, and that is excreted in the following way, that is disformation of epithelium through the urine, through sweat and loss of hair and nail. What are the factors that favoring iron absorption? The factors are heme iron, ferrous form in acid like hydrochloric acid, vitamin C, solubilizing agent, that is sugars, amino acid, iron deficiency, ineffective erythropoiesis, pregnancy, hereditary hemochromatosis, and increased expression of DMT1 and ferroprotein in duodenal enterocyte. What are the factors that reducing iron absorption? The factors are inorganic iron, ferric form of iron, alkali, that is antacids, pancreatic secretion, precipitating agent, when there is iron excess, decreased erythropoiesis, infection, T, and decreased expression of DMT1 and ferroprotein in duodenal enterocyte, and lastly increased hepcidin. Then what are the methods for assessing the iron store in our body? First of all, we have to do the serum iron profile, and the serum iron profile contain serum iron concentration, total iron binding capacity, percentage saturation and the serum ferritin level. Then we can do the bone marrow aspiration and bone marrow biopsy. We can also do the liver biopsy, erythrocyte protoporphyrins and other. In iron deficiency anemia, we have to know also about the causes of iron deficiency, and then the diagnosis of iron deficiency anemia. We also observe the clinical features, the blood picture. We can do serum iron profile. We also can do bone marrow examination. and we also have to do the differential diagnosis, and we have to exclude the differential diagnosis from the iron deficiency anemia. Why the iron deficiency is occur in our body? It may occur due to increased pathological demand for the iron, or there are pathological blood loss, or if there are inadequate iron intake. What are the causes of iron deficiency according to the age and sex? In case of female, in reproductive period, the iron deficiency occur due to the menstrual problem. If a patient have heavy menstrual blood loss, in pregnancy, the patient may have rapid succession or miscarriage, and in pathological blood loss include gastrointestinal tract bleeding, that means peptic ulcer disease. In adult, patient may also develop, in adult female patient may also develop GIT bleeding, peptic ulcer disease, and in infant and children, if there is deficient diet or diminished the iron store at birth, patient may develop iron deficiency anemia. What are the causes of chronic blood loss that occur iron deficiency anemia? And the chronic blood losses include uterine blood loss, gastrointestinal blood loss, that means peptic ulcer, esophageal varices, drugs that include aspirin injection, partial gastrectomy, carcinoma of the stomach, then carcinoma of the cecum, carcinoma of the colon or rectum, and in children there are hookworm infestation, and it occurs also due to angiodysplasia, colitis, piles, diverticulosis, and rarely for hematuria, hemoglobinuria, pulmonary hemosiderosis, and self-inflicted blood loss. That is all about the causes of iron deficiency anemia in our body. In our next class, I will discuss about the clinical features and how can we diagnose a case of iron deficiency anemia. What about our PBF findings? Inshallah, see you again in our next class. Till then, Allah Hafiz.